As you were saying there, the government's really quite reluctant to talk about an exit strategy, in part, of course, because there isn't one fully worked out. There's not a file, it's not completed work, but mainly because they're deeply worried about the idea that if they go around talking about a relaxation, that word relaxation will enter the psyche, people will stop their compliance with the rules. And they think, they stood themselves accused of mixed messaging before the shutdown happened, and they're acutely aware of the dangers of mixed messaging. They did, as you said, talk about 5 tests that would need to be passed to move to relaxation of the controls, and those are ones you would expect. Is COVID looking like it's under some kind of control? Is the NHS in a good shape to be able to cope with it if it slipped out from that control? But no more detail than that, and no idea really when this ends. Another important detail in the daily press conference at Downing Street today from the experts, talking about how they think transmission of COVID has come down significantly in the wider community, but could still be worryingly high in care homes and hospitals. Another subject, Brexit. We used to stand here talking about it all the time, reared its head again today because the government toughened its position on coming out of the standstill transition where we obey EU rules even though we've left the EU. It had been thought that the 31st December date looked pretty unachievable. That's what people in Brussels were certainly saying, because COVID had eaten into the negotiating time, stopped rounds of negotiations, made some of them remote, all the rest of it. The government hardened its position, as I say, and turned around today and said, we will not ask for an extension of that 31st December date, and if we are offered one by the EU, we will not accept it. In Brussels, they're scratching their heads about what exactly that means, but one certainty tonight: the shutdown goes on. We will live in this strange new world for some time yet. Romford in Essex, lunchtime today. The shutdown has thinned out the high streets, threatened businesses, emptied the nation's schools. Today, with the Prime Minister still recuperating from COVID-19, the Foreign Secretary announced the government had agreed. The shutdown continues.
The worst thing that we could do right now is to ease up too soon, allow a second peak of the virus to hit the NHS and hit the British people. It will be the worst outcome, not just for public health, but for the economy and for our country as a whole. So, the current restrictions will remain in place. The government will continue to monitor the data on the impact of the virus.
Mr. Raab said observing the shutdown had been an incredible national team effort, but it must continue for now.
And your efforts are paying off. There is light at the end of the tunnel. But we're now at both a delicate and a dangerous stage in this pandemic. If we rush to relax the measures that we have in place, we would risk wasting all the sacrifices and all the progress that has been made. And that would risk a quick return to another lockdown, with all the threat to life that a second peak of the virus would bring and all the economic damage that a second lockdown would carry.
He listed tests that would need to be passed before rules could be relaxed, focused on falling COVID impact and strengthened NHS provision. But the government senses even those most locked in by the shutdown will back an extension.
So I'm okay with it. My wife is going a little bit stir crazy.
I share a flat with my mother's at 80, so when I come in, I literally strip off. I have a watering can outside with bleach and everything on, so we wheel through the trolley, strip off, walk through everything, and then come in and take all the clothes off and go up and have a bath, and then that's it.
The only time when I go out only like every 2-3 days to buy like groceries and stuff. Otherwise we stay home all the time, and the longest we go, it's this balcony.
The government's top scientists said the shutdown had reduced transmission of COVID-19 in the wider community, but it could still be worryingly higher in hospitals and care homes. Government sources say they're extremely wary about talking up exiting the shutdown for fear people relax their compliance too early. The Health Minister, Nadine Dorries, tweeted this morning, journalists should stop asking about an exit strategy. There is only one way we can exit full lockdown, and that is when we have a vaccine. An EU promotional video for an iPhone app Brussels hopes could track infection hotspots before a vaccine is found and help to avoid a huge second wave of infections. The NHS is developing its own app. Those behind it say it'll work faster than the traditional health officer track and trace approach.
If around 60% of individuals use the app, then that would be enough to suppress the epidemic. But we've also discovered that even lower percentages of the population, so in the kind of 10%, 20%, as low as that, there is still an effect.
There was a teleconference of G7 leaders this afternoon. Dominic Raab standing in for Boris Johnson. Mr. Raab later said China could face hard questions about the origins of the virus at some point in the future, and a very, very deep dive review of what went on. And with at least 3 more weeks of a full shutdown now definitely lying ahead for all, the police in England have been sent updated advice on what is and isn't breaking the law. Driving to somewhere to take exercise, possibly okay. Home working from a park, probably not. Likewise, a prolonged sit-down on a park bench.
She was very independent and very proper, and she was very dignified, sort of didn't like imposing on people and things. You know, they said it would take the old really easily. You know, it comes home to you like that it takes your mum. It really, really hurts.
Jill Flux was exactly the sort of person society is trying to shield from this virus. She'd previously had lung cancer and, aged 76, was recently diagnosed with terminal pancreatic cancer.
They weren't expecting her to pass away immediately at that point?
Oh, no. She wasn't that ill.
Jill and her son Toby hoped she still had many months left to live.
Did you believe right away that it was coronavirus that killed her?
Well, I went to see my mother's body straight away on being informed, and was given, sort of paper mask, gown, gloves. It was pretty clear to me that it was likely.
Jill's death in a West Sussex hospice was recorded as pancreatic cancer. Although she was tested for coronavirus before she died, the results only appear to have come back after her death was certified by a doctor. She had tested positive. There is no mention of COVID-19 on Jill's death certificate, although the paperwork completed by the doctor did indicate there may later be more information.
Hi there, do have a seat. Thank you.
Testing should make certifying deaths far more straightforward for GPs.
You open your mouth for me, say ah.
But there isn't widespread testing, so GPs are being asked to use their own judgment in extremely challenging circumstances. Earlier this week, we revealed allegations from someone deeply involved in the registration of deaths in an area in the south of England that coronavirus or suspected coronavirus was sometimes being left off the certification of non-hospital deaths by GPs in favour of other conditions. And they believed these deaths would therefore never be recorded in any official figures. Well, tonight we can reveal a GP whistleblower who also alleges that coronavirus or suspected coronavirus is being left off the paperwork that doctors produce alongside the deaths of some elderly people in care homes. The GP from the southeast of England told us, "I know GPs writing bronchopneumonia or frailty of old age on death certificates when they strongly suspect COVID to avoid running into problems." Well, the GP told us doctors were drowning in work, very stressed, dealing with patients who'd been stable for years, suddenly becoming unwell. And because of a lack of testing, there was high anxiety about what to do after a death. And this GP told us that they insisted on mentioning COVID-19 in the paperwork where it was suspected, but that often meant administrative delays and complications. The GP said, "I can imagine a lot of GPs will just put another cause of death to smooth up the situation so you don't have endless calls back with coroners and funeral homes." But they said, "I think if you don't document the cause of death as presumed COVID, it's the final insult really. The patient has died from this pandemic and their numbers are not going to be included." We asked the GP, "Do you think that's happening?" They replied, "Yes, oh yes, absolutely no doubt about it."
Being properly recorded.
England's chief medical officer on Monday said this.
Obviously, everybody who sadly dies the doctor will make an assessment based on her or his view about what the cause of death is. That's what the death certificate says in all cases, and doctors take it very seriously and try to make sure that they get as much information to give accurate data.
Tonight, we've heard from a Scottish care home who alleged that 2 residents died untested with symptoms. But coronavirus or suspected coronavirus was not recorded alongside their deaths, and it seems they will not be included in any official